Do it. That would be good.
I know, as soon as the camera goes, I was gonna say,
There we
everybody stop waving.
We will officially call this Tuesday, May 7th, 2019 Board of Health meeting to order at 7:01 p.m. The agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. This meeting is being broadcast live on WACA television and will be rebroadcast numerous times. Is anybody else here recording the meeting? Seeing none, we will open it up for citizens' participation.
Sorry. Do something a little different. Good one.
Let me take a deep breath. It's been a pretty good amount of time. Good evening.
Good evening.
Good evening.
Happy finally spring. Happy finally spring. Feels like a fling, so we've got to do our thing.
Pretty sure he started the last time the same way.
Well, that's how I started last. Yes. I have two things. First of all, Mr. Jon Fetherston, I've outlasted another one at the board.
Yes, you have.
I'm gonna have a pretty good list. You can see behind me. You gotta come back and haunt me, aren't you? Make sure I keep talking. Nothing.
In ways you might not expect. Yes.
Halloween's coming.
It's the only day of the year I fit in, yeah.
And the second thing is, it's not on the agenda, and I'm gonna be happy about it. This is Diane Mortensen. I know it is on the agenda, but I'm gonna say, I'm gonna say it. I'm gonna say, yep, following your mother-in-law or mother's footsteps, whatever the case is,
Mother-in-law, yeah.
at Nyanza, so there's gonna be a blow up somewhere.
Hmm.
So I'm gonna say, I know what is number 4 on the agenda. I'm gonna just make up my own, as I said to him outside, heckle signs, and just go on from there. Thank you.
Thank you, Mark. And is there anybody else here for citizens' participation tonight? Seeing none, we'll move to item number 3, which I know nothing and do not support.
And, John, you're always doing the talking, so if I may, Mr. Chair.
Please.
First of all, you have a very good audience out there. You have a previous Board of Health member who's
Yes.
been with us for ultimate years and with you as well. And we also have our Medical Reserve Corps Chair who's been with us for many, many years, and it's nice to see them as well with his wife Karen and Mark. It's always good to see
Yes.
you. What we were planning to do, John, is just highlight some of your years here.
Oh, boy.
And obviously, I've seen a lot of you through my years.
Yes.
So if you want, I can start if the board so wishes, or the board can go ahead of me, whatever you wish to do.
It's all you, Mark. Go ahead.
Okay, well, I'll
just get it
start, and I'll read this out with my allergy voice. I hope it works out well. And there's an intermission. And then after the intermission, I have some final words.
This just in from a listener on Green Street. We like your allergy voice.
There's too much media, social media stuff going on.
Wow.
Tell it's gonna be an
Well,
interesting
John, I'm going to
meeting.
read this to you, and you're sitting right next to me. I had to write it down because there's so much to say about you.
Oh, thank you.
Well, first and foremost, John, you've committed your time to this community, and it includes major areas, including recent public health initiatives that include opioid reduction and tobacco initiatives, including flavor and vapor product sales. And you always seem to take a charge and move with the board as a whole. Also, John, you've involved yourself at community events, including emergency vaccination clinics. If I'm not mistaken, Mike, you were a selectman when you helped us with the H1N1 clinic.
Mm-hmm.
And you've been at many green up events, even up till this Saturday when you showed up on your day of work, and also many years prior with your sons to help out with the cleanup effort. So again, many thanks for just some major ones I'm discussing, but you've done much more than that. As a Board of Health member, John provided round-the-clock on-call coverage including investigations at rest homes, at oil and mercury spills. These might bring back some memories, John. Restaurant sanitation complaints, restaurant fires, just to mention a few. And thank you, because I sometimes was on vacation, I couldn't be there, so your help was tremendous in the on-call coverage. As a Board of Health member, one of John's major attributes was his understanding of the community public health mission, and he listened to staff and supported us on our day-to-day work to meet public health goals and objectives. John's leadership skills with staff and the board members has always been appreciated by me, and I'm sure by all of us, and I will always be grateful for being able to serve under you, John. As you know, John has always been considerate to our businesses when creating and enforcing regulations, but never swayed from the serious consequences for their mistakes, such as with sale of tobacco to minors. As I said, you were considerate to them, but you never swayed. You understood the public health consequence and the seriousness of it. John's leadership roles were reflected with his ongoing dialogue with management. One of the many interactions that comes to mind was John's effort to prevent heat stress in our schools, if you remember many years ago, and his commitment to this matter by communicating heat stress at the school committee meeting, the one I couldn't find that night, because I didn't realize they started meeting at the middle school, and I went to 2 other locations before I found you and Adam.
Remember that, yeah?
Oh, that's why I'm just trying to highlight some of these. And you've always been an excellent master of ceremonies. So this is a hard role to play, because you're always playing the best roles of master of ceremonies, including recognizing our many community members for their contribution to public health, and most recently being an event coordinator, which I thought you did an excellent job at our recent vaping session.
Thank you.
So this is where the intermission comes, because we have something to give you.
Oh, boy. Oh, you shouldn't have. You shouldn't have.
And then I'll read a little bit after, but enjoy your gift first.
Wow. This was totally unnecessary.
Yeah, I'm saying
Wow. Wow. But greatly appreciated. Yes. Wow.
Yeah.
So now it's time
That
we
is very
recognize John.
Present it to Jon
We
Fetherston.
recognize John with a clock. And the reason we're recognizing John with a clock is, one, as we all know, Ashland is Clock Town. But more importantly, in my view, is that the clock represents all the time and dedication that John has put into this board and to the town itself, because he was a former selectman. So it represents not just the town's clock town, but also the time you put into this town. And now you can watch time go by until you decide to come back. But again, as a civic leader in town government, as I noted, selectman, Board of Health chair, truly appreciated. And John, you and I will someday cross paths again, because we're both Rotarians, and I hope someday to work on a mission with you with Rotary International. Thank you, John.
Thank you, Mark. Thank you very, very much. Thank you.
I'm gonna stand.
Thank you, sir. Thank you very much. Thank you. Thank you. Wow. See, I was thinking you were gonna mention the time that I insisted when I was the selectman that you guys get to go home during a blizzard.
I was
Remember
going to
that?
mention that. That's when I really said, he's a nice guy.
I really like him.
It
Well, that was
a
very,
terrible
very-
storm. Thank you, John.
That was very, very sweet. Very, very sweet. And I don't know if this is a good time to do it, because it's probably a good time, because you can just ask my wife. If I had feelings, I would be very shaken right now, but my wife will confirm to you that I really don't. But that was very, very nice to do. I've enjoyed my time with the town. I've loved this town. It's the town that I had my kids grow up, and I can't think of a better town to serve. And especially want to thank all of you guys, because the last couple of years have not been the easiest of the years, but I think we're all better because of it, and we've also learned a lot. There will be a lot more in the news probably in the next coming days. It's not a name that none of you are not aware of, but or the board is aware, and the public might become a little bit more aware of my battles with Bob Mortensen, But we'll address those as they come along. And, Mark,
I thank you
you are well
for
aware of that. And,
understanding who I was through all that and your support through that. I was very fortunate to have you as a chair at that time, and you were very grateful in helping me through a very, very difficult time in my life.
well, and like I said, I don't want to get all choked up, but I'm on the verge of doing so. So let's get back to business.
All right.
Thank you very much. Thank you, Laura. I didn't give you a hug. So.
Sorry.
Laura's my favorite, everybody, just so we're perfectly clear.
Now I'm jealous.
Now, so, yeah, he's like, it's my last day, I can call her.
Laura's everybody's favorite.
Well, there you go. There you go.
And QHR.
Well, you've been an asset, and so you've all have been an asset. Well, with that, it's an honor to item number 4, our Medical Reserve Corps functions. Mike Gurnick, Chairman of the Ashland MRC. Thanks for joining us tonight. You want to pull up a chair? And, thank you.
I want to thank all of you for having me in. I know John, Mark has been wanting to get me in here for quite a while. Just a matter of schedule. Diane I've known for
Thank you,
a
Mike.
little bit of time. So,
Thank you.
what I want to give you all is just one of the most recent brochures from the MRC. Just give you an idea of what it is, how it works, what it does. And one of the things the MRC is, first and foremost, it's a national program. So it used to be administered under the Office of the Surgeon General. It's since moved on to an administration out of Health and Human Services known as the Assistant Secretary for Preparedness and Response. And what that actually is, besides being a mouthful, is it actually is responsible for planning and emergency management support across all of healthcare, across the whole country. So administratively, it went from the Office of Surgeon General into ASPR. And my perspective, since I sit on 2 national committees for this, one is in Washington, the other one's in an all place in Nebraska. But it's a good thing as far as resources go. The problem is always about funding, because you're not going to look at the warrant and see a line item for the MRC in Ashland. It's federal money. We don't have public health in this state that is organized around county government systems. A lot of other states do. Most other states do. So what we have organized is a region. And you'll see in that brochure what that region actually is. And there's some changes that Mark and I had a meeting about today. Back of it. And that, I think we were in agreement that the regional arrangement, as it's being changed up somewhat, is a good thing. It's going to mean more resources at a local level like the town of Ashland. So it's going to be, going forward, something to watch. It's going to be a change, but I think at the end of the day it's going to be helpful. Just a little background. I've been involved with this since 2006. We organized under Region 4A, which is explained there in the brochure, and that is our defined emergency management public health region. Ashland happens to be one of 31 towns in that region. It's kind of like herding cats for anybody who manages that environment. But nonetheless, in 2009, we, I think, provided like 1,400 vaccinations for kids, elderly, and other at-need population because of H1N1, the flu outbreak then. Last year, right, winter, we provided a warming place in a last-minute notice out of the community center because of the massive power outages. And we've also had people from this group actually travel, in some cases to the southeastern part of the country during hurricane outbreak. We've had, Mark was involved in one of the ice storms in the Berkshires. So while it's local and the mission is still medical, we have a wide variety of resources to go through. So at the end of the day, we do have an active membership here. It probably hovers around 30 to 40 people, we think. One of the points of the meeting today, and some of the things that are going to change with the MRC is 31 towns is pretty unwieldy to try and do anything with. And not having that county option for government is an issue. So what the state MRC group decided to do was break that 31 town region into 2 north and south sub-districts, which I think makes a lot of sense. Because if you look at that map, it's very not likely the case that you're gonna have somebody from Ashland going all the way up to Wilmington. You know, yeah, so that's an issue too. And so there's gonna be more activity going on. We have two new regional directors plus an oversight person for the whole region. So we'll be working closely with our sub-district, our southern sub-district coordinator, which I think is gonna be great. I think it's gonna be a lot more resources on board. They're gonna coordinate things better for Cory checks that people have to go through for volunteering, training that occurs. They're gonna be able to do more of that locally, which is important. So that's kind of where things are at.
Badging too.
And badging, people have to be credentialed to have badging. We haven't done that for quite a while. And it's it's good to see this develop, because for myself at the local level, I've only got so many resources to work with. And it's tough to try and keep the ball rolling, so to speak. But nonetheless, we've got a good group here. And I don't know, Diane, how many people you think did one of the flu clinics that we did?
That was a lot, yeah.
There was quite a few.
Yeah.
Yeah, there was quite a few. And of course, you know, we don't work independently alone. We work with the school nursing staff, with our paramedics. So, so with that, going forward, I think between Mark and myself, we're gonna keep everybody notified and up to date on things going forward like that. It's not out of the question that sometimes maybe we wanna hold our own training session right here in Ashland for a variety of different things. So that's something that we'll entertain as well. So that in a nutshell, I'd encourage you to take a look at the website. There's some changes going through that. That brochure is actually, as of today, dated, so there'll be some changes with that as well. But nonetheless, you know, take a look at it, and all of you have to sign up as MRC volunteers. I mean, that goes without saying, right? You have been.
I was gonna say, I'm assuming once
Yeah.
you are, you're always, right?
Absolutely, absolutely.
I'm assuming there's
Yeah.
no way.
You could check in, but you could never leave.
I
Yeah,
know.
some things never change.
Well, I didn't know when we had the warming center last year, I know there was lack of interest. I'm not too sure if it's lack of interest or lack of enthusiasm. So that's the only concern I have, is that I would love to help with it if we could
Yeah.
energize people again to know that they're available for us if we have something.
Since we do have a new South coordinator, that person's gonna be responsible for a
Okay,
lot of that
okay.
sort of thing.
Right.
Get the ball rolling again on a lot of this. I've lost some people because they've moved out of town.
Right.
That's been an issue too. It's a tough thing to have a volunteer group who's involved in something conceptually, but not actively as a participant, because we really don't have anything confronting us. There's a lot of things that are out there in public health, like the measles right now, but yet it doesn't affect everybody. So there's an issue with that. The other thing I could put out for all you folks to consider too is, as a public health function, when we did open up the warming center, I mean, we coordinated with all the other department heads to see how this was gonna run. The fire chief of department, who was Lynn Morahan at the time, acting.
Strangely enough, the
Yeah.
fire chief and I were in Aruba. Both of us were in Aruba.
But not
in
together.
the same location while this was all going on, so.
Yeah. But in terms of-
Unfortunately weren't here, so it shows you
Right.
you need your depth.
Yeah, in terms of an instant command system, which you'd have to operate under those conditions, that's the way it's
And
gonna
that
work.
went very smoothly.
It went okay.
Yeah.
It went
It went-
okay.
yeah.
If we had a large number of people, that would have been more of an issue. But at the time, Framingham was good enough to say, if you really need to consider sheltering, come over there. You know, so that was an
Yeah,
option.
I know we talked about it, privately, but I mean, my concern was that the internal was perfect.
Yeah.
We met, we were
Right.
there,
Right.
but
Yeah,
just we
whatever-
didn't have the volunteers come to help staff it.
Yeah.
So that's the only,
That's definitely an issue, and I was out of town when you called me.
I know you were.
So-
I was
so-
like, help.
It's like, yeah.
Yeah.
But nonetheless, I mean, that's something I think we're gonna see an uptick for
Right, and I'd be
with the new
glad to, like,
coordinator. Yeah.
If there's anything that needs to be coordinated, I'd be glad to help with it as well.
Yeah, as things go along, especially seeing the new people on board administratively, I think that's gonna be something, and more information's gonna get disseminated,
Right.
you know,
And
so.
maybe just even myself, just trying to get maybe people
Oh, yeah,
involved as well.
yeah, absolutely, absolutely,
Yeah,
that's what it's all
especially-
about.
Yeah, anyone you know in the community, Diane, that would be great.
Yeah, absolutely.
And we did involve Nancy Cleary on this call we had today. We had a call with our South District
Yep.
coordinator, Annette Kerbo. And we want to make sure Nancy's involved because she would be coordinating with the school nurses if we ever had a natural man-made disaster that would cause for possibly sheltering again, as we needed the Warman shelter, or emergency dispensing of vaccines to the entire community, and within 2 days would be required for issues such as anthrax. So we have to be always on alert and prepared. In Framingham, you mentioned, I see the Framingham Health Director walking our way. They've been helpful with us as well, and as we know, they allowed us to coordinate with them on their flu clinic, and hopefully down the road even with public health nursing. Hi, Sam, we're talking about you.
Yeah.
You came in at a perfect time. We're talking about Medical Reserve Corps, the new Southern Coordinator, and how Nancy, our nurse, was involved, but how Framingham has helped us through not just the time when we possibly needed your help with the warming center, with the storms of 2 Marches ago, also where we're going with flu vaccinations and so forth. So you came in at a perfect time. Sam Wong, Public Health Director for Framingham. Thank you, Sam. But Mike, go ahead. I didn't mean to
No,
interject
that's
that
pretty
much.
much it. If anybody has any questions, I'm here to answer them if need be. Otherwise, this is something that's gonna be going forward. The federal presence is minor. Everything is done at the local level. And it's really a coordination between, like myself and Mark, that get a lot of these things organized and get done. But to Diane's point, we definitely have to have a greater presence from a volunteer cadre. It's there, but we need to pull that together. And, frankly, having done this for a while, I would rely on the region to get their act together and say, okay, we gotta do more things and make it more visible. That's the whole point, is give it more of an identity.
So we could,
That's what
we
was
could pass on your number and name for people who are interested in knowing more
Yeah,
about
sure,
it.
that's fine.
Thank you.
And they can call here as well. We coordinate this list together. And they can call Diane as well, and like Diane knows, many community members, whoever, we're just trying to get as many people to volunteer, so when the time is, when we're in need, if some can't make it, maybe the others can. We need the depth.
Yeah.
Yep.
Right.
Now, Mike, where does your funding come from? Just so people understand.
Health and Human Services, principally. There's also an organization.
Line
called-
item with the,
It would be under that, right. There's also an organization called the National Association of County and City Health Officials that I've been involved with for about 10 years. It's both a grant source for funding as well as a policy approval organization. I'm more on the policy approval side. I do get to look at grant applications from time to time. It's all federal. NACHO is a member organization for the most part, but they're still under Health and Human Service funding to a great extent.
And we're fortunate that Mike's involved with the National Association of City and County Health Officials. He's been on a few of their task force,
Yeah.
but our money is public health emergency preparedness money, and those funds come from the federal, as noted, down to the state Department of Public Health Preparedness Division, and from there down to the locals, and it gets distributed through Region 4A, 4B. And for MRC, we have just 4A. But we are combining our efforts with 4B, with the Medical Reserve Corps as well, including possibly a major regional website to attract, so if we attract members, we send them there, they get set up to get registered, badged, as well as to be quarried. And that way we'll have more opportunity to get volunteers in here. We need to recharge it, as Mike said.
no, just so if anybody's listening and watching and is interested, what type of volunteers are you looking for? Just so you know, like.
Anybody who is upright and walking, to say the least.
Okay.
The mission is medical. That's obviously the case. But for instance, Diane can testify to this. When we did the flu clinic at the middle school at the time, probably it was a ratio of like, for every medical volunteer we probably had like 5 others to handle administrative duties, things like that. As far as the actual administering a vaccine or something like that, that takes one person about 2 minutes.
Right.
But to register people, to direct traffic, to bring people in. So it's a lot of, and if we did have a major outbreak, that we were gonna get what's called part of the Strategic National Stockpile for vaccines and antibiotics, things like that, that's a lot of heavy lifting. I mean, literally. So that's a lot of coordination, and, you know, you're gonna get not only our health people involved, but you're gonna have to have security through law enforcement. So it's involved, it
And that's why I
involves a lot.
asked, because I don't want people to be watching at home going, well, I don't have any medical background. You just need people
No,
to.
absolutely not.
You can,
You know,
Absolutely not.
you can be clerical, you can be
Yep.
strong
Absolutely
young
not.
man or a
Yep.
strong young woman, and yep, so,
If you can-
any and all volunteers.
Yeah, if you can point a finger and direct traffic, you know, that's fine. That works.
I'm not being sarcastic, but you have to be over the age of 18?
Yes.
Okay.
Yeah.
Because that's what I was gonna say, even for the warming center, I mean,
In
as
some,
long
I'm
as
not
it's a
sure how
responsible adult.
Massachusetts works, but in some states, a parent can sign off on a consent, and there are youth organizations that are part of Medical Reserve Corps, but we don't have an active one in the state. There's something called HOSA, which is hospital, it's an occupational background, but it's a high school level thing. And I spoke at Metro West once with those folks, and they're kids who are studying to go into healthcare eventually, not necessarily as a physician or nurse, but they're going to be some, you know, facet of healthcare, some delivery somehow, and they're kind of on a learning track to do that. But as far as actually being a volunteer, you need to be 18.
Good.
Good job, Mike.
Thank you. You've heard all this before.
I know, but I can hear it
All right,
again.
listen, I want to thank everybody, you know, for having me in, and we'll keep you posted as things develop and change.
and we wanna thank you, Mike. If
Absolutely.
I did my math right, you're going on your 14th year.
Could be.
I was gonna say, as his wife is here, be careful, she might, she might be like, wait a minute.
Yeah.
Better take her to dinner now.
I know,
Yeah.
I hope
Actually,
you have
that's
other
more true than
plans.
not. Good seeing you. All right, again,
Well,
thanks,
thank you.
everybody.
All right,
Thanks
thank
for
you. All
coming
right,
in.
good night.
Take care.
Very much.
We'll follow up as well.
See you next time. Somewhere.
Mr. Hart, I need a favor. Do you mind if I jump the agenda and go with? No, no, no.
No, I don't mind
You-
at all.
I don't think you've met Ed. Ed, Sam, Ed. Sam is just coming on a favor. Please come on, please come up, come
Ed
on.
is too, but Ed's
No, I know,
very
I know.
nice. Ed
Ed's
doesn't
ver-
have to travel as far.
I have to all night, my wife's out of town, so
Okay.
I don't have to get.
So why stay here? Come on up then. Come on up and we'll get you, well,
I get
hopefully we
Sam
can.
in trouble.
I think he's
Yeah,
basically
really.
asking to go to Stones after this.
I was gonna say.
Thank you. Good evening.
How you
Turn it
doing?
over to you, Mark.
So as I noted, Sam Wong,
Hi, Sam.
Framingham
Hi.
Health
Sam.
Director.
Thank
We
you.
mentioned him before when we talked in budget terms, looking at regionalization possibly. But Sam also provided us with the Framingham tobacco regulations, which he thanked us for ours, cause we were we started looking at it, well, we were hoping other towns would, and I thank Framingham for looking at it as well. They have a little bit extra in their regulations that we don't have, and that's why I asked Sam to come to our meetings, so maybe the board may wanna consider this, have another public discussion sometime with our vendors and see where the board wants to go.
First of all, I would like to thank you for this opportunity to talk to you, and also thank your leadership in taking the lead on regionally to restrict menthol and mint flavor. And learn from your example, we decided that we should do that. And as you may know, southeast corner of Framingham has a fairly large immigrant population, and menthol is, you all know that is the targeted minority neighborhood for the advertising. So we did that. We also did another thing that we're getting considerable pushback from our convenience stores. Is we also restrict what we call smoke accessories. Smoke accessory, our definition is any tobacco accessories or marijuana accessories, or if you like to smoke oregano, I guess you can also use that. Any type of accessory that we commonly see in convenience stores, now we're restricting them to also adult-only tobacco stores, or a properly licensed marijuana retailer. In Framingham, we're gonna have 6. So those are the not on the south side, not close to Ashland, by the way. Yeah, we did a zoning change, so the marijuana retailers would be along Route 9 and Route 30, right off the exit across the street from Red Roof Inn area.
So easy access, okay.
I know.
So, that's what the city voted for.
Right, I know,
We oppose, the health department will strongly oppose any retailers located on the south side of Framingham, which is good for you guys. So we did there, going back to the smoke accessory, we also restricted the smoke accessory to be sold at convenience stores. That seems to be getting quite a bit of pushback. That means that a convenience store or gas station, they will no longer be able to sell the equipment.
That's huge, though.
And we do have, within our town, paraphernalia being sold at convenience stores.
We are seeing more and more gas station and convenience stores selling glass pipes. And we don't think it's a good idea for kids or adolescents to be able to expose to that. And also, we are seeing the starter kits from Juul and other vaping manufacturers, including the equipment, the vape pen, but also a couple of the pods together as a kit. That seems to be pretty popular as a, for lack of a better word, initiation kit.
Starter kit, yeah.
Starter kit. So we want to limit the access to that.
That's great.
That's why we did it.
Well, one of the reasons why I jumped at the opportunity from your emails the other day with Mark and to the rest of the region is talking about, is the vaping. You know, to say that this board, I wouldn't say we got tremendous backlash, but we got some backlash from it. But I think it was the right decision at the right time, and for a big city like you to then follow suit to it, I think sends a strong message to the community and the rest of the Metro West area and the rest of the state of Massachusetts. I think it's huge. And I'm glad you brought up the marijuana, because that is my concern. You know, you've got the vaping. You know, you look at all the information that the CDC is coming out with. Vaping is a huge problem, and it seems like most people still have their head in the sands with it. But you talk to any high school principal, you talk to any college professor, you talk to any superintendent, it's a huge issue. So I'm very impressed with the fact that, you know, Framingham stepped up and as fast as you did. My question, one, was there any backlash from the industry? And two, just so you can explain it to people who are watching, what's your timeline? Because we have a timeline as well. I'm hoping they run like kind of parallel to each other.
We are getting some inquiries for public record requests from a law firm representing some of the convenience stores.
Okay.
So
We know him well.
Yeah.
We know. Nice man. Yep, very nice man.
Yeah, we see that is a potential first step for them to file a case against us. We also receive a fair number of inquiries from convenience store owners to ask about what their regulation entails. There seems to be a lot of misinformation out there. People, I don't know, for legitimate reasons, they're confused, or for misinformation on purpose. Somebody posted on a letter to the editor in the local media, even says that the Board of Health is restricting all tobacco product from 62 vendors we have to only 4, which is not the case.
Right.
And that answers your, hopefully answered your first question.
It does.
What was your second question again?
Just, you know,
The effective
I'm not
date.
saying that vaping is a gateway to marijuana, but I am saying that they probably go down similar paths.
Mm-hmm.
And vaping is now, there is now marijuana vaping.
Oh, absolutely.
And I don't think a lot of parents.
Longer than now.
What's that?
It's been around quite a while.
It's been quite a while, but I don't think, you know, busy parents, 2 working parents, you gotta get homework done, you gotta get somebody to soccer practice, take them piano lessons. I don't think they're aware. Cause still, I think a lot of people are like, you know, even still, you know, the circles I run in, you know, my kids are in college now, but what's vaping, you know? Like, how can you not know what vaping is? You have college-age kids, how can you not know what vaping is? And I just worry that now, yes, the people voted it in, and, you know, marijuana is legal, I understand that. But do parents need to be concerned about there that high school kids who aren't supposed to have access to marijuana and vaping, they can get both, and they can get it easier than any of the older people sitting at this table can get it. What do you worry about as a public health official of a huge city now? What is your concern about it as well?
Going back to the marijuana piece, another reason for us to regulate quote-unquote smoke accessory is because when we develop our local regulation to regulate adult use marijuana last year, we have a regulation adopted last August. We had a lot of issue or trouble regulating the marijuana accessories because some of the accessories are dual use. People can use a packed pen to vape nicotine and THC. If we just regulate the marijuana accessories, the convenience store can sell exactly the same type of accessory, claim that they're only for nicotine, not for marijuana. So that means we really are not regulating it. So at that time, the Board of Health in Framingham, we didn't include any restriction on marijuana accessory last year when we do our marijuana regulation. The only thing we add in is if you want to purchase a marijuana accessory, you have to be 21 and above. That's the only thing that we put it in. And we want to come back to look at the smoke accessory issue. That's why we did it with the tobacco regulation and create a new definition, lump all the accessory together, called smoke accessory. Right now, we know that it's only nicotine and THC. We don't know what's going to happen 2 years from now. A new substance might be introduced. People may be vaping that. So we want to lump it all together, call it smoke accessory, and regulate it that way.
The accessories that are sold in the convenience stores now, do you have to be 21 to purchase those in the convenience store?
Right now,
Yeah.
before the regulation go into effect, no.
You don't? Okay.
It's only the quote-unquote substance, the tobacco products.
Gotcha. That's interesting.
Because, I was
But-
just gonna say, so, I mean, we could all make an assumption whether they're using it, you know, for whatever product that they're putting in the device, but no matter what product it is, they need to be 21 or over.
For the equipment right now, no.
No, but to me, it makes sense to
Right,
make it
right.
21 because you
Right.
can't buy
Right,
combustible
Well,
cigarettes.
right now, you
or
can
any-
be 18.
right.
Right.
No, right now,
No age that I know of.
No age, right? Or no age.
No, well, this.
there's
and I'm
no
speaking
age
for
requirement
us.
for the equipment, though. The
At all.
substance, yes. Not,
In Ashland, we don't
Ashland
have.
too.
Yeah, I'm just saying,
Anywhere.
like,
Point, yeah.
there's no, we don't,
We don't restrict it, yeah.
right, somebody
it's a
15
no-brainer.
years old can go into a convenience store to buy the equipment,
Oh, boy.
Right.
and there's no regulation stopping them.
right.
That's correct.
Wow.
And that's another reason we want to put in some regulation to make sure that our adolescents doesn't have access to that.
Now, what's your oversight from your department going to be? You're gonna have 6 recreational marijuana shops. My concern has never really been the combustible marijuana. I mean, we can talk all night about, you know, what I think. My real concern from a parent and a public health official has always been the edibles. Is your department gonna have any oversight on the edibles?
Yes.
And can you explain that?
Yeah, part of our local regulation, we adopted several things. One is adopt the state Cannabis Control Commission state regulation by reference. So everything the state regulates, we automatically is part of our regulation. We also adopted the food code as part of the standard that edibles will have to comply to. The state, for some reason, if you sprinkle some marijuana substance or products onto a food, automatically under the state's definition, it's not food anymore.
Okay.
We see it differently.
Scary.
We see it differently, and we want to make sure that edible marijuana product have to comply with the same standard as food. So we adopted that as a local regulation. Otherwise, it's not considered food under the state regulation. They have their own standard you have to achieve, but that standard is a lot less stringent than the food code.
Can I just ask you one question, and it's a little naive to
Yep.
that. So are they actually making the products, are any of these places making the products on site?
You mean retailers?
Right, the 6 places, are they making?
No.
Okay, because that's
None
what I was
of
gonna say,
them.
so you're regulating it, even though it's coming into the town, it still has to follow those food standards, even though it's being made someplace else?
For retail sale, you have to follow the retail requirement. But we also have manufacturers coming into Framingham to make the product like a
Okay,
factory.
Okay, so you do have
So-
somebody coming to make the
correct.
product, okay.
Correct.
Okay.
One example would be one manufacturer is coming in to make ice creams.
Marijuana ice
ice
I
creams, yeah.
did see that in the newspaper.
But I guess, and I'm not trying to put words in your mouth, so you're saying that like a retailer can't make like marijuana brownies in the back room, is that?
Well, that's what I didn't know when you were saying
Right.
that, when you're
They-
saying edibles, I didn't know if there was a place that was making cookies or lollipops,
There-
but, I mean, you're having some place that's making ice cream.
Because we had the Cannabis Commission in here too, and I just want, and this is, I think you bring up a good question, I wanna make sure. When we had Jennifer Flanagan in from the Cannabis Commission in here to kinda talk to us about it, and she said everything had to be marked and everything had to be logoed, that it
Correct.
was already, it's already been.
Correct,
So it's all, and that regulation is seen,
correct.
okay.
I'm sorry.
So there are fusion restaurants which are coming up in different towns here, so they may come up here too, who knows? Which prepares and sprays or mixes all these cannabis
But,
products.
and again,
onto
I don't know this manufacturer, they're not, I mean, it won't be a storefront that, I mean, well, maybe it will be, I mean,
We're talking two different things. What you're talking about is what they call social consumption establishments.
Right.
Cannabis Control Commission at the state level, they are putting a hold on that. They will look into that later this year.
so they're
Right
not
now,
allowed right
it's
now.
not allowed.
Okay.
So you cannot
But is
have
this
a cannabis cafe,
manufacturer
for example.
Packaging ice cream to sell to a retail establishment?
Correct.
Or is it a storefront that somebody
No.
goes in and buys it? No.
No.
Okay,
So at a storefront, everything will be coming in prepackaged.
okay.
They're not breaking it apart, they are not
not-
portioning
okay.
it. So it comes in prepackaged and sold prepackaged.
Okay.
The
But hypo-
manufacturing facilities are strictly manufacturing facilities, no retail.
Correct.
But hypothetically, you could go to Stop and Shop on Temple Street or in the Stop and Shop over behind Lowe's in Framingham, and you could buy marijuana ice cream in Framingham?
Not in those locations, but specialized
Just in the-
retail
Just
shop.
in the marijuana retail?
So you'd have to go to
Correct.
a retail,
You'd have to go to retail.
You have to
retail
be,
establishment to purchase,
correct.
okay.
So one of the 6 locations would be able to put in a freezer with proper label and everything is individually wrapped, sold to a customer that way, with the label, with the concentration or the dosage.
So just because I'm concentrating on the 6 because it seems like a lot to me, but so you have 6 retail establishments, and how many
Correct.
manufacturing do you have?
There's no limit to that.
I know, how many are coming to Framingham?
That we know of, right now it's only 2.
Okay,
And do they fall in the oversight from you, or is it all state?
Yes,
oversight? Okay.
and the third aspect of the Board of Health in Framingham's adult use marijuana regulation is we require licensing. So we becomes the only licensing entity on an annual basis for all of these establishments. So every year, just like a restaurant, they have to come back to us, renew their license, and we go out to do annual inspections.
And did you get any additional staffing for this? From the state or
No.
for your budget? Did the mayor
no.
add a line item?
N-
No?
No,
Wow. That's a burden on the staff right there. Wow.
yeah.
Guess we shouldn't feel so bad.
I was just saying the same thing.
Wow.
Well, we see important enough that if it's not us, who else?
Right.
Right, but does it affect the functioning of inspecting other facilities in other manners? Like the food inspection may go down in terms of quality because you're spending the time on the marijuana inspections.
Yep, that's
So
always been a
it-
struggle. That's
so-
always been a struggle. But
So instead of localizing, maybe there may be 1 or 2 people affected because of the marijuana, but there may be 10 people get sick because a restaurant is not properly inspected.
correct.
So we have to weigh pros and cons and see it. So
Looking for more resources has always been part of our work. And one idea that we are thinking about is to, approach the city council to request a forming of a revolving account so that we can retain some of the permit fees.
Yeah, you should, yeah. Now, one thing that we were told here, and it's kind of disappointing, a lot of this has been disappointing, and I've often said, if you voted for this, you didn't get what you voted for, and if you voted against it, you didn't get what you voted for. I mean, to have people stand in line for 4 hours to pay a 20% tax on something, and the government try to tell you, well, it doesn't affect the black market. Yeah, it does. Because who has 4 hours to spend, to spend 20% on something? But we were told that the state was gonna come up with inspectors. And I haven't seen anything from that the state has inspectors.
Maybe they do. I haven't seen
Yeah,
them
but
yet.
you haven't seen it, yeah, well,
We haven't
They
seen
didn't
them
even
yet.
have training sessions either.
right, yeah.
So,
So when's your first store opening? I know the one on Route 9's coming along pretty quick there.
We have one medical dispensary already opened. They are in the process of getting the adult use license. And we don't know which one is going to start first. There's a couple other locations they are thinking about starting the renovation. We have received two applications so far. They have to get the host community agreement with the mayor's office, and then they have to apply to the state, go through that licensing process, and then they have to come back to me, or I shouldn't say me, our department, and apply the licensing.
talked about the sale of accessories being banned. If that comes as an accessory to some other product that's being sold as a free gift, would that be considered as a sale?
We prohibit that. You
Right.
cannot gift away any of those products.
Oh, okay.
As a smoking accessory.
Essentially, they cannot distribute it in their
Right.
premises, okay.
Can I ask you another, back to vaping? I know, Ron and I have gone to a couple of meetings for the decisions that I returned, and they were talking about, the penalties in the school department
Mhm.
for youth
Mm-hmm.
that get caught vaping. Do you know, I mean, we received information, which I'm assuming was accurate, but it didn't seem, up to date. Do you know if they're working on, like, changing a policy in the Framingham school system, or do you work with
They
them
are,
with that?
yes, I work
Just
with
what I
them
understand- okay.
closely.
Okay,
It's very difficult. Not about changing the policy, but what to do with the kids that get caught.
right.
Suspension is not the answer.
Right,
A
from what
lot
I
of time,
understand, Framingham has a automatic out-of-school suspension, versus Ashland has an in-school suspension with education. So that's why we're talking about the difference.
changing the policy actually is not the difficult part. The difficult part is there's no established
Treatment?
treatment for adolescent addiction to nicotine. There's just no established treatment. We talked to quite a number of pediatricians. That's what we've been told.
Especially through the vaping process.
Well, that's what I just was curious
Right.
because I was surprised
In,
about the
in,
process of them being eliminated from
in,
school for the day.
and the school is still figuring out
Right.
what to do. I know that there's a pilot program in Hopkinton. They work with, I think, Spectrum, maybe?
Yeah, and then there's one in Lynn that we were discussing on Monday at our meeting for vaping, and it included the Framingham nurses from the schools.
Yeah.
And they were talking about a program in Lynn that is for diversion and to keep, as well as treatment, since now we're dealing with addiction.
Correct.
I commend, I mean, I was pleasantly surprised, and I commend the people at the school department because it's not an out-of-school suspension. If a youth gets caught vaping in the bathroom or wherever, they have an in-school suspension, and they're required to do a 3-series of a training to educate them, as well as, of course, the parent, and the parent has to, actually get the vaping device. You have to give it to the parent. But I was glad that was the process that we've changed over to because of the education part. And there's, like I said, there's 3 different steps, 3 different people that you actually receive training from. So versus, because, I mean, this is what they told us at the meeting, is that you suspend a kid, they're gonna be right outside in the parking lot
That's right.
vaping.
That's
So
right.
by
That's
suspending them and sending them home, that
That's
defeats,
right.
yeah. So I think we've come, I think, far. I think that was a good thing to learn what our school does for
On the
kids.
Framingham side, we're working on it.
Yeah.
We know that the school leadership is very supportive of this issue. For example, the chair of the school committee and also the superintendent came to our Board of Health public hearing when we changed our regulation, and they came and supported the Board of Health, so they know that this is a serious issue, and we're working on it.
Great.
I appreciate you taking the time. I just have one more question for you because Mark mentioned earlier today, Mark and I are Rotarians. And my current president of my Rotary Club, which is based out of Natick, we're a regional club, is also, I don't know if you're familiar with the organization, Spark Kindness. They do a lot of work in Natick and everything. They had a vaping seminar a week ago Wednesday night. And we meet as Rotarians on Thursday morning in Natick. And she came in and she looked like she lost her wallet or something. I'm like, what's wrong? She's like, I just want to let you know. We spent all this time, we spent all this resources. I never marketed an event more than I marketed a vaping event. We had 8 people show up. And she was devastated. Nice, sweet lady. You've met her, Christine. You've met her. Great lady. And she put all this time and effort into it. And so I'm like, well, maybe I shouldn't tell her tonight that Framingham just did backed up like what our regulation. But my point is how do we get the message out to people? Because it's not getting out. It's not. We all know it's a problem, but it's not resonating with the community. What do we do? Do we work collaboratively as a region? Does Ashland and Framingham wave the flag and we start?
No.
Do we go to?
No.
What do we do?
What you describe is not unusual. We had that experience quite a few times in Framingham, and also before Framingham, I spent a number of years in the town of Hudson. We also have the same issue. You have any public forum for parents to come. Those that came usually are not the parents that you want to reach out to.
Right. That's the truest thing
so
that's be said tonight.
We're changing tactics. We're in close communication with our superintendent. We are requesting some of the events that the school put together on every year, like orientation, going to high school, or athletic event when we have a room full of parents already captured. It's a capture audience. We're asking for maybe 5 minutes, 10 minutes to just talk about the most important points so that more parents can be exposed to it. So that's the tactic we're working on right now.
I like your new superintendent. He's good.
Yeah, he's fantastic.
Yeah.
I know, again, information we've taken from our meetings is I know that Ashland's going to start working towards the 7th and 8th grade versus usually it's like a 9 to 12, so they're going to bump it up a little bit to maybe target the younger kids maybe before they, to educate them at a little bit younger of an age as well. And Ashland did the same thing. They had a mandatory event. I don't remember, I think it was an athletic event maybe, but there's a mandatory event for the parents to attend, and they still didn't come. So, I mean, it was required, I should say. It wasn't, and it was, it's hard. That's what they said they're dealing with as well, is getting people to come, and the right population, like you said.
Right.
But it was a funny story with the superintendent. I was in the superintendent in Framingham's office a couple weeks ago because we were doing a dictionary project. And he's like, you're from Ashland. He's like, Ashland banned vaping. He's like, I'd really like to talk to those people. I'm like, I know a guy.
I might know somebody you can talk to.
I know a guy. So he was very passionate. He didn't even know who I was, and he was very, very passionate about it. So it was good. It was nice to see.
Yeah.
Now, when does your regulation take effect?
January 1st.
Just like ours. Okay, so
Right.
that's good.
That
Good.
was based on recommendation from City Solicitor's Office.
Good. Well, I want to thank you. I think it's great that you've done this, and I think tonight's my last meeting on the board, but I'm sure the board would be more than willing to help.
What happened?
They got rid of me. No. No. Time to move on to a bigger and better opportunity. So.
What? This is too small for you?
Too small, but.
He knows the big
I'm
guy
just
in the
kidding.
corner office.
I'm just kidding.
In Boston.
I don't like the marijuana law. Is all I'm going to say. So that's all I'm going to say. But we got something. But I'm going to say, as neighbors, you know that, you know,
Yes.
you need the neighbors, the board's very, very proactive.
Yep.
You know, Mark has a deep passion about anything the board can do, you know, they're just a phone call away.
And with Mark's assistance, that we probably should work with Natick and Southborough and our surrounding community to do the same thing. I mean,
Yep, get the word out.
public health issue doesn't recognize our artificial municipal boundaries.
We gotta, we gotta take Joe White up to
And
lunch.
I am trying with
in Natick.
Marlboro,
Right, we
and
talked
one of
about
the Board of
having a
Health members is
meeting,
working
but-
with me, but it's
Yep.
taking time.
Yep.
But I mean, we did talk about having a meeting with the other communities to see, you know, beforehand to get them involved as well, so.
Again, I thank you for inviting me to come, and thank you for taking the lead on this issue, and so that we can learn from you. And I really enjoy working with all 5 members. We only have 3 members, by the way, our Board of Health, which is very difficult. They can't talk to each other.
Yeah.
Right, yeah.
Talking is a
Quorum. Get
violation.
quorum.
I know.
Yeah.
Mike Hugo counts as 2. He's still on, right?
No, he's not.
Oh, he's not on anymore?
He's not.
His wife is still in the school.
Uh-huh.
Yes. Yes.
Wow. All right.
Thank you, Sam.
Hey, Sam, do you mind, I was asked by a publication based out of Framingham if we could get a picture tonight. Is that
Sure.
possible? Mark, do you mind taking a picture?
Mark, you,
Mark,
wake up.
Yeah. Oh, you don't wanna be in?
I'll take it.
You add value to
You
pictures.
doing the whole board?
Yeah, you want to?
Sure.
Better get a picture of you holding your award, too, John.
Oh, that, you know what, that would be nice too.
Yes.
Mark, do you mind? Do you mind getting a picture in front of the Ashland logo, Sam?
Come on the side.
Yeah, that's probably good.
Big Mark,
You can come part of that.
It was the Framingham source, just so you know, Sam. Come on over, Laura.
I know Laura can see it.
Yeah, you're the man of the hour. You got it? Oh, you gotta turn it around the other way, Mark.
Oh, okay. Oh, there we go.
Oh, that's on,
There we
now it's
are.
on record.
Oh.
Oh, that's okay. My smartphone is smarter than I am.
Generations past me.
All you do is push the white button. See that white button?
Twice a day, right, there you go.
Take a couple there, cheat, Mark.
I hit that white button and
Bingo.
it's out.
And help him out.
Did it go?
No,
No.
all right. Can you help him then?
Your wife wants you to pick up milk on the way.
Yeah, I got it.
You know how to do
Well,
it.
you don't want me to read the messages here, do you?
Sure, why not? A lot of hate mess.
Maybe, well, I have
Oh,
I don't have a phone like that.
Oh boy, who knew this was gonna be this difficult?
Ladies and gentlemen of the public, we'll be right back.
There we go.
Right.
Oh, Laura, how's that?
Yeah. Ladies touch.
Lord,
You know.
Laura, you don't want to be in?
I'll take the picture.
Yeah, just
Very
take it.
nice.
I got 3.
So that's what happened. Now you get in there.
Jump in,
Okay.
Laura. Yeah, I'll grab one of you two.
Yeah, then I'll
Just
hold
right
up my
there.
And then
clock.
Mark will read.
Then we don't have to do it
John's
again.
There you go. Cool.
Very nice.
Yeah. Mark's face.
Okay, I got 6 to.
Thank you, guys.
Mark was very dedicated there.
Look at,
Get it?
he probably has a video.
I think he's
You
wearing
better check that out.
Thank you, Mark.
Before I kinda get over my head here,
Get it.
That's
So
okay.
I just wanna
Thank
grab
you.
my.
Sam, thank you very much.
You're welcome.
It's a pleasure. Thank you for taking time out of your busy schedule. Of course. Much appreciated.
Thank you.
I noticed Farmers Round Market is closed.
Take care.
Have they surrendered their tobacco? No.
Thank you.
Are they required to?
Yeah, if they don't in 60 days, anyone's up, it's up for grabs.
Farmers Round Market.
They haven't come in, have they, Farmers Round? They haven't surrendered their permit?
Ed, thank you very much for deferring. Would you like to come up? Thank you.
I'll send you those pictures.
Oh, you got it? Oh, thank you.
Very nice.
Okay, yeah, Sam's excellent.
You can.
So is
What is this?
Yes.
Is that yours?
Ed is very good.
Does he-
Just got it yesterday.
Now, first of all, I have to make a correction from last time we met.
Uh-oh.
Did you get Mark, did you pass on that letter that I
I'll
sent?
let you stand
Okay,
corrected.
fine, okay.
Doesn't happen very often.
two errors.
So technical, I forget. But,
Well, it was, I mixed up two citations, and it was a serious error if somebody wanted to do some research, but they discovered the problem right away. It was 40 CFR 152.170 was mixed up with 40 CFR 152.25.
We're gonna dock it from your pay.
I know, yeah, it was terrible, it was
I
terrible.
know. Please
But,
don't do that again.
but the thing of it is that the first one, 170, dealt with the way that the EPA determines the toxicity of pesticides and limits them to professional applications because they're so toxic. And 152.25, however, talks about pesticides that can be used easily in integrated pest management programs. They're very, very safe. So there was quite a mistake there, if somebody wanted to do any research on it. Another thing also is that I had said the lowest lethal dose that they had on these regulations was 1 teaspoon for a person that weighed about 75 pounds, and it's actually a quarter of a teaspoon. So I was doing the math here while I was waiting, and I was rushed, and I missed a conversion factor. So those are the two main changes I wanted to make. And I have about 4 important things that I wanted to cover tonight. I have 9 on my agenda, but I won't cover them all. The 2 important ones are, there are 2 bills before the House now, and they're brought forth by Carmine Gentili from Sudbury. It's House Resolution 791 and House Resolution H 792. And 791 deals with the change to the Mass General Laws, Section 6G of Chapter 132B. And it basically states that pesticide products eligible for outdoor use at schools, childcare centers, and school-aged childcare programs, the regulations would be changed. Right now, there are 4 different sub-chapters to this. They're gonna wipe them out and replace them with 2. And those 2 basically refer to that section, that citation I just told you, 152.25, it's in the federal law. And then there's another
Repeat that
one.
number again?
It's 40 CFR 152.25. And I'll read the proposed changes, is that Chapter 132B, Section 6G of the General Laws is hereby amended by striking Section 6G, A through D, and inserting the following. A pesticide classified with the United States Environmental Protection Agency as an exempt material pursuant to 40 CFR 152.25 as amended, or B, a pesticide including no active ingredients other than those published in the national list at 7 CFR 205.601 as amended. And that is a list of approved inactive ingredients, additives, emulsifiers, whatever, that have been judged to be safe for use. So when this change, if it occurs, and it's, right now I think it's before the Joint Committee on Environment and Natural Resources and Agriculture, if it passes this summer, then the Ashland pesticide regulation can just refer to this, because this is a great improvement. It basically eliminates a lot of things that we were talking about last time, one of which was glyphosate. So that would no longer be able to be used on school grounds, and that's basically what Ashland decided on years ago. But there's an even better one, H 792, that the same gentleman from Sudbury is also introduced. And by the way, both of these House resolutions, bills are sponsored by Jack Lewis and a number of other legislators. I didn't, however, see Senator Spilka's name on that. And what I would encourage the board perhaps is to send a letter to the senator and ask her if she would support these 2 bills, because they're very, very important. And
Probably though, because they're in the House, yeah.
Yeah, right.
Probably,
Yeah, you see, and
Right.
that's, you're right. But then when the time does come, it'd be nice, I know that Jack Lewis, Representative Lewis is supporting him. It'd be nice also if Senator Spilka, and I'm sure she will. But it doesn't hurt, I think, sometimes that let your representatives know what the town thinks, because they do pay attention. And H 792 is an even better bill. An act relative to the prohibition or the transfer or use of glyphosate in the Commonwealth. This is very, very all-inclusive, and I won't read the entire of it, but I'll read Section A. No person, firm, partnership, association, limited liability company, or corporation shall distribute, sell, offer for sale, or use glyphosate or any products containing glyphosate within the Commonwealth of Massachusetts.
Wow.
So
That'd
that
be
would go a
huge.
long ways.
Huge.
Yeah, that's really huge. And it's a first step too, because there's other pesticides that are also dangerous. Chlorpyrifos, we talked about last time, and 2,4-D. is another one that seems to be replacing glyphosate on farms this year and next year. But those are two very important things that I wanted to cover tonight. Just to let you know that there are two bills before the House, and hopefully they will be passed. They passed on to the Senate, and the governor will sign them in. And if that happens, then that'll go a long ways towards what we've been trying to do and limit the use of pesticides in our town. And it'll be limited in the state.
Do we know, just for curiosity, because we just talked about enforcement, it's like, so, I mean, off the top, I can't think of any place here in town that it would affect, maybe, but what would be the enforcement, like, would it be up to the Board of Health to enforce? that
They
don't
actually have
it on
pretty
themselves?
strict, let's see, well, section 3, any person, firm, partnership, association, limited liability company, or corporation that violates any provision of this chapter or any regulation, order, license, or approval issued or adopted hereunder shall be punished by a fine of not more than $25,000 or by imprisonment for not more than 2 years in a house of correction, or both, for each violation. And B, shall be subject to a civil penalty not exceed $25,000 for each such violation. So that's a lot of teeth. Whether or not that
I just
passes
didn't know
that
if it was
way.
it would be enforced by us, I guess.
It would have to be, because like
So we would-
hypothetically, if like Sears hardware store was
Right.
still in play.
We'd have to make sure they don't have any products, so that's, I'm just thinking that would
Right.
be,
Yeah.
it's a lot of work.
Yeah,
Like, would Ashland
if,
Lumber have that?
if the law was passed, then
may.
all the
Yeah.
stores would know that, and they would just take them off their shelves.
Especially now
You know,
with the retailing.
they're not gonna
Right.
risk, Home Depot's not gonna risk,
Yeah.
being
I mean, it's-
fined.
Yeah, okay.
you know.
I just-
And it's funny, the other day I was driving down to Home Depot, and I came back, and there's a daycare center where I saw somebody spraying something across the,
Well, I'm glad you brought that up, because Saturday morning, I'll protect the guilty. I'm driving to Green Up Ashland to meet Mark. A local company drives into my neighborhood, and guy gets out of the truck, and he's spraying. And usually, when he's spraying, you don't see anything. This had color,
oh,
like a green tint to it in the air, and I don't know if it was the morning sun and, you know, cloudy day and the sun was hitting, I could see it. And I'm sitting there going, what in the name of God is in that thing? Because,
it might have been safe.
okay, might have been.
Yeah.
How do we know what's in that?
You gotta go up and ask him what he's spraying.
Okay.
I've done that, and there are products, there's a lot of them are, extracts of things like spearmint. There's a few other plant-based products, they're perfectly safe. There's a company called, I think it's Zevo, that is coming out, with some products that are totally safe, you can spray it on your food. But it does, affect, it kills the insects instantly. I haven't researched the exact mechanism, because in pyrethroids, I know what happens, it stops the calcium uptake and the nervous transmission, but I don't know what these particular, substances do, but I remember when I first heard of it, I read about it, and I read the ingredients, and I thought, oh, well, there's nothing that is dangerous.
Well, I'm glad you brought it up, because I don't know if you know where I live off of Oak Street on Heritage.
Okay.
My backyard is all conservation land.
Yep.
It's all trees.
Mhm.
I have dogs,
Mhm.
and every year we fight the battle with ticks
Yep.
and everything like that. And our neighborhood has been getting blanketed with these tick removal, like, come in,
Oh,
we'll
sure.
spray your yard, and we'll guarantee you won't get any ticks.
Yeah.
Your thoughts?
No, there's no substance that I know of that's safe to use against ticks, that period. The most common one is permethrin, and that's a pyrethroid derivative, and that, it's a suspected carcinogen. It does work. You shouldn't spray it on your skin. You can spray it, I mean, I've used it. I've sprayed it on my clothing and on my shoes, in the few times I've used it maybe 3 or 4 times in the past year. I don't encourage its use. You have to be very, very careful not to inhale anything. You have to do it outside, make sure nobody's around when you're doing it. I use it very sparingly, and it's only when I'm going out into deep grass and I'm concerned about getting ticks, because I've already had a couple of bites and I don't wanna, have any more in the rest of my life. But as far as I know, that's the only thing that's really effective. DEET isn't as effective as permethrin is.
They do sell a product, and I don't know what chemicals in it, but they do sell a product that you can spray actually on the dog, like
On the dog?
yeah.
Yeah, I don't know what, there are a
And
number
it's
of,
not, it's just like a bug spray.
Yeah,
is what it
right.
is.
Yeah, we bought the, Serestro,
yeah, that's what I use
collars.
also. I use
Yeah.
that, and they're supposed to be pretty good.
Yeah,
The vets say they're
knock
good.
on wood, like, they
Yeah,
better
so
be for
far.
the money.
Yeah.
but-
Yeah, I know, yeah,
But,
yeah.
But, so you wouldn't recommend those? Because getting back to my original story, when I was driving and the guy was there, company, just doing his job, but there were 2 dogs in the front yard, and I'm thinking,
Yeah, I know. It has to be safe.
so the dog
product.
goes back in the house, walks on the carpet and the
Yeah,
floor.
brings it in.
Brings it inside.
Oh, sure, yeah.
So,
There's a,
yeah, it's safe outside, but if it,
Well,
Is
that's
it safe
another thing
inside?
too. It depends on what it is. Now, some of the things are more toxic than others. A lot of the permethroids, they're very dangerous for cats, deadly to cats. But most of us, we can detoxify it, I guess, in our liver, and we don't run into that much of it, the higher concentrations. You have to consume quite a bit of it in order for it to have any adverse health effect. But nevertheless, I mean, there's a cumulative effect on a lot of these things also. You know, we're exposed to so much in our environment. I advise people to avoid it at all costs wherever you can, whether it's an air refresher, you know, an endocrine disruptor and an air refresher, or fire retardants in furniture, whatever it is. Whenever you can avoid exposure to a petrochemical, I would advise everybody to do so. And now that spring and summer are coming, people are exposing themselves to petrochemicals all the time with insecticides, spraying their backyards or worrying about ticks or whatever. And there are companies that will spray a yard with a substance that isn't harmful to humans and animals, but nevertheless it kills the insects. And that's another thing I wanted to talk before I left, because even though when I'm talking about it usually is the health effects on humans and house pets when it comes to pesticides, but just the indiscriminate killing of insects just because they're there is ignorant. We're in the midst of a 6th grade die-off of all species, especially of arthropods, and they're essential to us being here on Earth. A lot of insects are essential to the pollination of plants. We lose these arthropods, we start losing plants, and along with them go foodstuffs. So this is a serious issue. It's been studied in Germany. There's a 76% decline in flying insects in Germany. There's an 80% decline of flying insects in Puerto Rico. In Northeast, there's a serious decline. I don't know what the percentage is, but a serious decline in a lot of flying insects in Northeast. I read a study in Michigan. They were talking about bumblebees. There's 19 different species of bumblebees in Michigan. They're responsible for pollinating the cherry crop, a number of big crops. This is an agricultural concern. And these in blueberries, and bumblebees are necessary to pollinate some of these plants because they vibrate when they go and they collect nectar. And a lot of these plants, like the blueberry, is very difficult for any other insect to pollinate it. And they're all pollinated by wild insects. You start losing these insects, and oh, by the way, I'll give you some statistics on loss of bumblebees. It's shocking. But you start losing some of these, and eventually it's going to affect us. And it won't be that long before it does start to affect us.
It's
Here
already
it is right
affected the
here.
wine industry in Napa and Sonoma.
Yeah, right.
They can't pollinate the grapes.
And also, there's glyphosate in almost all wine.
Mm-hmm. No.
I mean, there's pesticides in the soil, too. Cumulative effect is killing the soils. So that forces them to use more fertilizers. It changes the whole dynamic of agriculture. And we've done it stupidly because they're looking for profit and getting as much as they can out of the ground as quickly as possible to make as much money as possible without thinking down the road of the effect that you're having on the environment and the soil and in public health. Rusty batch bumblebee, 100% decline in Michigan. American bumblebee, 98% decline. Yellow-banded bumblebee, 71% decline. Yellow bumblebee, 65% decline. Those are the worst. Like I said, there was 19 different varieties that they tested, and this is only in one test in one state, in one area, and this is all we know about just this one insect. We have no idea what's going on with the rest of them. And a lot of it has to do with encroachment on habitat. Some of it is climate change, global warming. These insects they just do not reproduce when the temperature gets too high. Yeah, cell phone, yeah, technology, all of it, pesticides, all of it has an effect. Light at night, I talked about that last time. You know, you don't have to have all your lights on like you're at a landing strip at Logan Airport. You know, turn them off. You save money. It's better for the environment. We're looking at net zero. One of the ways you can do it is turn off unnecessary lights. It also affects insects because they use the stars and the moon in order to navigate at night, and they think that the light is the moon, and so they go. That's why you see insects flying around lights. Don't see a lot of them anymore, though, do you? I mean, I told you last time, I haven't seen an eastern.
No.
Yeah, you don't.
No.
For years.
Like when you were a kid, you used to.
That's
yeah,
right.
yeah.
Used to be everywhere.
Yeah.
They'd be on your windshield when you drive.
Right.
You don't see that doesn't happen anymore either. It's because they're just disappeared. And this is serious. This is very serious. A lot of these things we're going to see in our lifetime. We're losing, like I said, we're losing species at an alarming rate. I have some other statistics I can give that are pretty shocking. Okay. Of all the mammals on Earth, 96% are livestock and humans. Only 4% of the mammals on Earth are wild. and they're in danger. 50% of them are in danger of going extinct before, I think, the end of this century, maybe be the middle of this century.
Say it again, only 4%
Only 4% are wild.
are wild, wow,
That's how many domestic animals there are on this planet.
wow.
And of course, it's humans that have domesticated the animals, obviously, cows, pigs, chickens, and of course, there's a lot of humans also. As far as the total biomass of the human race accounts for just 1/100th% of the life on Earth. 82% of the life on Earth is plants, 13% is bacteria, and 5% is everything else, and out of that everything else, we're just 1/100th%. And yet, 86% of this life is found on land, only 1% in the oceans, and 13% in the deep subsurface bacteria. Since the rise of human civilization, 83% of wild animals have been lost. We've lost 83% of wild animals, 80% of marine mammals, 50% of the plants, wild plants, and 15% of the fish in the oceans. This is what we've lost just in the past century.
Wow.
And this is, we're in the midst of some serious changes. This has economic effects also. A lot of people in the planet, they estimate about 1 billion people on Earth, look to the wild fishery, the oceans, the rivers, the lakes, and the forests for food. And when this disappears, you have an awful lot of people that don't have any food, and they're usually in very poor places, and they're going to want to migrate out of there. And we're seeing this right now. The problem we had in Syria was because of global warming. I think it was 250,000 farmers lost their farms. They came into the cities for food. There was no food. And now they had an uprising. There was rebellion. Now there's a war there. There's an awful lot of immigration going on in Europe. I know I'm getting a little political in this, but this is the effect of it is from global warming and climate change.
Everything is connected.
Yeah, everything is connected. That's my point, right.
There's a series on National Geographic that I'm watching right now called Hostile Planet. Just started a few weeks ago, and it covers a lot of this stuff, and it is pretty stunning to see.
It's shocking, and it's all human caused.
Yeah.
So it can be human corrected.
Yeah.
But it requires a real tidal change in attitude.
Sure.
And I personally believe that most change happens in either the youth or in small towns. That's my opinion. I know cigarettes in the 70s was the kids learning it at school, going home and telling their parents, please don't smoke, I don't want you to die. And people started to quit. And it became much more, you see a lot that now when it comes to climate change. A lot of these young people started off in Europe, and it's also catching on in the United States. On Friday, they'll just walk out of school demonstrating that they want something done to protect the planet for them and their children. And they say that we have 12 years to act. We had the Sustainability Committee had a very interesting presentation in the library a little while ago. And it's pretty well advertised that we have 12 years before we can to really address this in order to turn around. Personally, I don't think that we have 12 years. I don't think we have 12 minutes. And I think a lot of this is, well, we can do maybe is slow it. But it's a responsibility. The way I look at it is the earth is, everything is created not by me. And I'm not going to get religious, but if there was a sin, I think the greatest one would be to cause a species to go extinct. Any species. I don't care if it's a gnat. A lot of these animals, too, are so fascinating. Speaking of gnats, they just discovered a protein, I think it was reservinol. I probably have that wrong, but it's something like that. You can Google it and find out. A gnat beats his wings 1,100 times a second. I mean, that's amazing. 1,100 times a second. A second.
Not a minute.
It's amazing. And it's a tiny little thing. It's no bigger than a letter on a page. And it has a sensory system, a nervous system, a muscular system, a digestive system. But every time you see one of these are animals, unique animals. And they're fascinating. And they're not nuisances. Of course, you have to protect your house from carpenter ants and termites. That's a totally different thing. And there's safe ways to do that, and you need to protect yourself. And you don't want to get a mosquito bite if you can avoid it. There's ways to do it without killing everything in the woods, though. And of course, tick bites, we're very conscious of that. But there's ways to protect yourself without killing everything. When you kill everything, you decrease not only the quantity of life, but the quality of life also. So I would encourage people to be more conscious, and not only just of exposing themselves to some of these carcinogenic chemicals, but also to be more responsible and think about the bigger picture. When you're using something, you have to try to be kinder to the earth, I guess, and to life, because it's serious. It'll be. I haven't seen a copper butterfly or an eastern blue or a sulfur in over a decade, and they used to be everywhere, and you don't even see any of them anymore. underwings, spanworm, all of these amazing animals that just are gone. And it's a tragedy.
Wow.
Yeah. So anyways,
Ed, what's gonna, I think you mentioned a few things. What's gonna replace this, from what you've read? I'm
replace.
sure it's not gonna be the glyphosate. I mean, there's gotta be something else, right?
Oh, you mean when it
That's
comes to
when-
herbicides?
After this stuff goes and they can't sell that, do you know what else?
Well, we had a discussion a couple of days ago. Somebody in the town wanted to get a special release to use Roundup.
Oh, yeah, grain up, we had
And,
that discussion.
yeah, and we were talking about the only way really that they had to remove the weeds was to pull them out.
Right.
I mean, there's other ways. You can use weak acid solutions like vinegar, and you can use flame, but that's kind of dangerous. Plants are tough. They want to survive, and nature they've evolved. Some plants have 198 chromosomes. There's a grass that has 198 chromosomes. It's designed to survive no matter what happens. Droughts, floods, cold, heat. They can go for years without any water and then suddenly spring back to life. You know, that's how amazing they are. So some of them, if you have something that's a nuisance, often it's just elbow grease is maybe the safest way. I know a lot of people don't want to hear that. They would like to spray something out real quickly and walk away and have all the things they don't like die and all the things they do like get greener. A lot of people are very, very proud of their lawns. They like them to look like carpet. And I've seen some beautiful lawns, and they do look good, but at what cost, you know?
Instant gratification, long-term effect.
Yeah,
You
right,
know,
yeah.
but, you know, I take a lot of pride in my yard,
Mhm,
and I
yeah,
went organic about
Mhm.
8 years ago,
Mhm.
and my yard never looked
Look better.
better
Yeah.
than it looks now, because it's all strictly organic.
It can be done. It can
And
be
even
done.
during like watering bans and stuff,
Yes.
my grass would stay green. And like
Exactly.
all my neighbors are like, "What do you do? Water in the middle of the night?" I'm like,
Yeah.
"No,
No.
you don't." So I mean, the benefits. I mean, it costs more.
Yeah, yeah.
It does cost
It
more.
sometimes takes a long more time,
And I was
too.
gonna say it takes more
Yeah.
time, but
Mhm.
even now, like when we've had a rainy spring, it's like I didn't really do anything in my yard this year, but it's just reaping the benefits of
Yeah.
going organic
Yeah.
years ago.
Right.
Yeah.
And you mentioned the water ban. That's very true. A lot of the, I think Kentucky bluegrass takes an awful lot of water, an awful lot of care. A lot of fescues, there's other grass, and I'm not an expert on that, but I know that there are grasses that don't require the care and the water and the fertilizer and all the other treatments that some other grass types do. And they're all green, you know, it's a trade-off. And it's also, it's a health hazard, you know, it's the last thing, is that a lot of these things are suspected carcinogens or carcinogens. There was a study that Mark sent me, and I had already picked it out and read it, and it's from the ATSDR is the acronym. It's, hang on a second, I'll tell you real
Asian
quickly about it.
standards, and they helped out with Nyanza years ago, too.
Yeah.
So another standard type agency at the federal level.
Right, it's a division of the CDC.
Yep.
And they came out, now, April 8th is when they released their study. And the headline in the papers was "Links to Cancer Shown in U.S. Federal Draft Report on Glyphosate." But they held back this report for 3 years. And then they heavily edited it. And they used very, very overly cautious language. And it was a meta-analysis of epidemiological studies. And my question was, who was the editor that chose the analysis to do the meta-study on? You know, I could have 20 in front of me right now, studies. 10 say that something is dangerous, 10 say something is safe. I'm the editor. I can choose 10 that say it's safe, because I have a political reason, or an economic reason, or whatever. I have a bias. Or I can pick the 10 that says it's very, very dangerous, for the same reasons. Or I can pick 50-50 and leave it up in the air, so that nobody really knows. In this study, I was a little disappointed at some of the language, because they didn't, even some of the people in the CDC complained that it really was awfully soft on glyphosate. But they linked it to cancer on, I think it's section 2.19. They have the meta-analysis on cancer, and they did link it to non-Hodgkin's lymphoma and other soft cell cancers. So even they couldn't deny it.
What's the exposure of it, like how?
That was the key. See, a lot of these studies, they're talking, most of them are laboratory studies too, that they really hinged on, but none of them are human studies, epidemiological studies.
Are they because of the chemicals being inhaled, or
Yeah,
through the skin, or
That's the thing.
drink
there's-
it? I mean,
Yeah, there's 3 different methods of exposure, through the
Okay.
skin, inhalation, and ingestion.
Okay.
And, you know, when a lot of these people are out there spraying the fields and there's drift, so they might be inhaling it, they're getting it on the skin, but also, you know, microparticles you can ingest without realizing it. In addition to that, we talked about this last time, there are 70 different foodstuffs right now that have glyphosate in them, and that's only because those are the ones that they've tested. We talked about wine has glyphosate in it. it's considered safe by the EPA, and I don't want to alarm people, because a lot of the science is still out there. But, you know, you have to be cautious on these things. If, I equate it to like a pond with ice on it, and you know, you want to send your kid out, he wants to go ice skating, and a regulating agency says, yeah, we think the ice is safe. Well, I wouldn't send my child out at night to skate on a pond where somebody said they think it was okay.
Right.
So if you think of that way when it comes to glyphosate, you know, try to avoid it if you can. And educate yourself, because the information is out there. You can educate yourself, you can find out, and you can make choices. And you may be glad that you did, because when you think back about leaded gasoline, asbestos, radium on watch dials, cigarettes, all these things, now glyphosate, you know, and other pesticides. We're waking up to the fact that some of these things that we weren't DDT, we weren't sure of. It sounded like a good idea at the time, because it was gonna solve a problem, and we just ended up creating other problems with our solution. And that's the part of human nature that we can't avoid. That's what makes us different. We manipulate nature.
I read a news article about sunscreen solution getting into the blood 24 hours.
It's been all
Yeah,
over the
right,
news.
yeah, right.
It's not, still, they didn't say
I
clean
just
safe,
sent
but
everyone an email
something
3
getting
years
into your
ago.
blood.
We had the same discussion.
Mhm.
I don't know if all the board members received it, that's why I just sent it back out. Talking about Monsanto and
Yeah,
glyphosate.
yeah, yeah.
We had this discussion, Joel sent us, what's Joel's last name?
Weinstein?
Arbeiten.
Arbeiten sent us an article.
Yeah, I remember that, right.
Yeah, I just sent it back to you as a reminder, and that was
Okay.
3 years ago.
Yeah, yeah.
May 2015, we had this discussion.
And this has been studied in Europe since way before that.
Yeah.
You know, they had it banned in many countries in Europe for a while.
Well, I hope you've touched a few people at home, because you come in here and educate me, and it's very impressive, so
I
I
could
hopefully
talk
somebody at home,
forever on
well,
this.
I think it's wonderful.
I was gonna
Great.
say, you know,
Someday you have to come with fertilizers too.
Hey,
Yeah, I
listen,
will.
we-
I'll talk to soil health if you'd like. That's another subject, yeah.
Come down.
Very
I
important.
think it's good for people who are watching as
great.
well.
Affecting
I mean,
the
it's
groundwater.
educating
Yeah.
me.
you wanna know what the sad thing is? I replaced him. He's the reason why I'm in this chair tonight, which I have to talk to you about.
Well, I just
But-
wanted to say, since this is your last night, and Mark spoke so nicely about you, I very enjoyed working with you, John.
I enjoyed working
One
with you
thing
as
that
well.
about the two of us is that we came from slightly different. I know John's, you might not know this, but John's a dyed-in-the-wool Democrat. He's way off, way off on the left.
Yeah. Maybe a socialist. yeah.
Ed, the reason you didn't get a clock is you have to come back.
Well, that's why I wanted to finish my point.
Yes, go ahead, I'm sorry.
As a former member, I thoroughly enjoyed working with you, learned so much
Same
about
here,
you.
same here.
Not only your education, but your mannerisms is
Yeah,
what I
I
always,
agree. Yeah.
always enjoyed working with you.
Yeah.
And I want to put in, because now in your current role on the finance committee, don't forget about my friends here, okay, next year, okay?
Because he
Uh,
can, yeah,
I-
plus
I
also
have
he
to
can
be
serve on
objective.
both of them.
And I have one closing statement.
Yes.
And I couldn't think of anybody more I'd want to ask in the
Sure.
town about this. Measles,
Oh, yeah,
huge problem.
yeah.
And living in the autism
about
community like I do, and a lot of people in the autism community say, don't vaccinate your kids, it causes autism.
Right.
I will tell you, as a chairman of a board of health and a father of an autistic child, you're a fool if you don't vaccinate
Yeah.
your child.
I
children.
agree.
I want to know what your
I
thoughts
agree,
are.
I agree. I have an open mind on everything. I like to, you know, and I have heard both sides. I still do. Every time I see an article, I read it and I judge it, but I think that there's no proof there, in my opinion. And I think that the trade-off is not worth it.
Well, see, you know, it's funny that you say that, not to cut you off.
Mhm.
I will tell you, in my mind,
Mhm.
not as a fact, in my mind and in my heart, my son's, I can tell you, he went for his booster shot.
Mhm.
3 days later, he was in the hospital with complications. Doctors don't know what was wrong with him.
Mhm.
Wakes up the next day, okay, he can go home, his fever broke, everything's fine. Whoa, what do you mean? What do you mean? This kid was screaming in agony and pain. 3 days after his booster shot from the pediatrician, and now he can just go home and he's fine. And then days later, my wife's like, there's something wrong, there's something
Ah.
wrong. So I've lived it, I've
Right.
seen it, I don't
Yeah.
know factually,
Yeah.
but I know. But still to this day, I have another son
Mhm.
who was vaccinated, and I would still tell you, you still gotta get your kids
Yeah.
vaccinated.
Yeah,
But
yeah. No, I agree. I think it's good practice. I'm sure that just about everyone would agree. In the absence of better
But
information.
this measles outbreak is huge.
But, you know, there's some buzz going around now that depending on when you were vaccinated and what vaccination you had, you might need to get a booster.
Right,
as well.
that's right,
Yeah.
right,
Right,
that's
so-
right, yeah. I think our generation that doesn't apply to, I could be wrong.
I think it's prior to 50, don't
Yeah.
quote me, in the mid-50s.
Yeah, right, yeah.
But there's a lot of parents out there now who aren't vaccinating their
I
children.
know, it's foolish, it's foolish.
Must look good for my age.
It is full.
And that booster shot is not harmful either. You can get, if you're unsure, you can get the
Yeah.
booster shot, and I'm pretty sure there's no harm from it. And there's other things too, Candida auris, Clostridium
auris,
difficile. Both of them are infections that, auris, for example, they say that may be due to the overuse of fungicides on grain stalks. So, and because bacteria, microorganisms evolve so quickly because they replicate so fast, that auris came along, and now it's pretty much resistant to most treatments.
Well, while you're here, we had the, Metro West Regional Board in. God forbid, Mark, if we had a measles outbreak, what, could we handle it?
Sam, you there? Can you send Kitty down, please? I would have to ask Framingham for help.
Yeah. And we'd have to quarantine people, and,
Yeah.
I mean, it kinda all ties into the theme of this meeting tonight, is we'd need regionalization, we need volunteers. And I
School
mean,
nurses
you
would
pray that
come.
it doesn't happen, but
Yeah.
School nurses
you could
would
be
help
talking a
too.
problem
Oh, yeah.
within
yeah.
48 hours.
That's right.
Yeah.
Yep.
Yeah, I mean, you're seeing all these colleges
Yeah.
quarantining these kids in school, they can't leave. and-
Yep.
Yeah.
That boat,
Yep,
there's a
the
boat
boat, yep,
someplace,
yep.
yeah.
I'm
The news.
confident that we could pull it off.
Well,
I
confident
have
we can pull it
confidence.
off. But Chris couldn't come, he's too old. He needs booster shot.
He's in his own age category.
Well, yeah, you're a wealth of knowledge,
Well,
and
it's my pleasure to be here.
I think somebody should probably write a letter, you know?
Oh, yeah, that's right. That was the other thing. I thought that there was a gentleman that was going to present you with a letter to Governor Baker about the gas pipeline.
We told him that you had that to present to the board, so.
I emailed him. I thought he was going to.
Oh, and I said,
can tell you
oh,
very
yeah,
quickly, and I
said
can
one of
pass
our
that on.
yeah, go.
There's 94 communities, it might be 95, that have joined it in a
And
letter.
KG, just so you know, passed this along back 2-3 months ago, but go
Was it?
ahead.
Okay. About, and I thought it was about the gas pipeline, but it might be about natural gas altogether. Might be the health effects to natural
It
gas
is.
is what I
It-
thought.
it-
It's all about
Yeah, I
natural
was gonna
gas,
say,
not
yeah.
necessarily
Okay.
the pipeline.
Cause
Yeah.
I read it.
And the boards of health, you read it?
Yeah, I read it just in case it got brought up, because
Okay.
I'm abstaining from the discussion about the Eversource pipeline, so I didn't know. if
Because
we-
it's going
This-
through where you are, right.
This was part of the discussion at the
MAHB.
MAHB,
Okay.
in the last fall.
Yep.
November. And that's when he gave, that's what I asked at the time, whether we signed anything that came, and he said no, so.
I have a copy
think
of
we
it, I
need
can pass it on to you.
I know, probably we should get him out here and then,
Well, the board
up
could
to you.
invite
Educate us.
Steve, and he's very nice to
There's
talk
another
to.
public hearing on the gas line too, right?
Yeah, it's
Right.
supposed to be before the
That's-
Conservation
that's
Commission.
specific to Eversource, but this is not
Yes.
specific.
Right, no, I
to
know,
Eversource.
but-
Six, is it,
Just-
May 26th?
Just in general, because I did read the email, I
Yep.
read the whole trail, which
Mhm.
was lengthy, but, so my understanding was reading that is, wants us to put together a statement
Mhm.
saying that natural gas is not a good source of cooking.
Yep. It can contribute to asthma. I remember from the letter. Of course, it's always been dangerous.
Yeah, and
Go
I'm
ahead.
probably just not there, but I'm not ready to put
Yeah.
my name on a
Yeah.
letter
Yeah.
saying that,
Yeah.
because I just, who am I to say if John cooks his,
Yeah, what are you gonna do if you have gas
so what,
hookups?
so, I mean, here we are talking about pesticides, which
Yeah.
is, you can maybe educate people and
Yeah.
maybe they could make that change.
Right.
Mhm.
But for me to say to the residents here in town, it's really not healthy to cook with gas.
Well, there's another thing about gas
It's not
too.
like you can
I know, yeah, if you have it, and that's what you're using, what are you going to do, basically?
Right,
you
and
know,
it's,
yeah, and
and so
especially,
even if we declare it and just pass on information to the people,
yeah.
where do we go with that?
Well, like I said, I initially thought that letter had to do with the pipeline. And then when I read it, I realized, no, it was about the health effects of gas. And I felt somewhat the same with you, but mainly because I was focused on the pipeline. It's not that I don't care about the health
Well, I just
effects
think,
of gas.
even if we make that,
Would-
like, what's the?
What's the alternative?
Right,
But
well, what's
however,
the next, I mean, if we're telling people that it's not healthy and we're putting a statement on writing, we should help people with an alternative, and
Well,
there's no.
part of, that's the difficulty. Sometimes you can't. But part of the discussion also is the effect that methane has on the atmosphere. For example, I think there's like a dozen gas leaks in the town of Ashland that haven't been addressed yet. It's on the Eversource pipe website. Also, fracking releases a tremendous amount of methane in the air. And I've read statistics, it's over 30 times as powerful a greenhouse gas as carbon dioxide. And that's a very, very serious thing as climate change, global warming. It's the biggest challenge that we face right now as a species. And so on that side of the argument, that's just one more reason perhaps to avoid using gas. It's an argument for climate change, the climate change argument. Stop using it because also it causes asthma or it causes health defects, and try to steer away from it. Personally, I think that Eversource should be spending their time on researching on solar or renewable energy sources instead of going back to what I consider whale oil and buggy whips and anvils. I mean, this is ancient history. This is the modern age. If this is a company that can't deal with the modern age, they ought to sell it to somebody else and let somebody else come in and handle it properly. I don't see any excuse for this at all, other than a bottom line excuse, and we can't accept that as living.
We at least can
beings.
hear him out and see what the reasons he has. We may not sign on the letter, but
His name
he
is
comes here to
Steve
present
What's
it.
your, like, what your, I mean,
I know,
What's
we
your-
don't have to sign on the letter, but we
No,
can
you
at
don't,
least
yeah.
hear him
what's
out
your,
and
like, what would be our purpose of having him come in to speak to us?
find out what other effects are there so people can get educated and come up with probable.
Yeah, I really can't give an opinion on it.
I have gas in my house.
Me too.
I
Okay.
mean,
As do I.
and
But you know
so,
what?
I-
like,
What are you gonna do?
I'm not gonna sit here and
No, but you
judge
know, but-
anybody for cooking with gas, cause I have gas.
But it's an interesting, because I originally thought it was about the pipeline until I started
yeah.
reading it, going, this isn't about the pipeline.
Right.
And to KG's point, I mean, he signed up how many towns?
94,
95.
95 now?
I mean, so he signed up, he's convinced a third of the Board of Health in Massachusetts
Yeah.
that this is a good idea. I'm not saying that I agree with him, and I don't think I do, but I think to KG's point, it might be a
But
reason to
understanding
talk
what
to
it
him.
is, yeah.
You don't, you might not have to sign the letter, but, I mean, he has convinced a third of the state to do it.
I mean,
So,
we
all
have-
right, so, just be, I mean,
we also
so I
have
know this isn't a topic on the, so what is he gonna convince us, what is he convincing those towns to do?
To send a letter saying that, to the governor, that they don't support gas.
Perhaps to try to
Which
steer
I
in the
agree with you,
future
it's
away
kind
from
of
it.
Conceptually,
Yeah.
weird,
Maybe not to ban it for those that
Totally
have it.
random,
Yeah.
arbitrary,
Yeah.
not enforceable.
not,
Right.
we don't have a solution, there's
No.
no,
Right,
it's
you,
just
you know me,
very,
you don't
it's-
create a law,
and
you
plus
can't
I think
enforce
that
it,
if we
right.
have somebody come here who's a professional,
Mhm.
apparently a professional in it, cause he's convincing all these communities
Mm.
to come here and speak to the
Yeah,
residents
listen
of
to
our
what he has to say.
town, hopefully people watch. I just wanna make sure that we can back
Yeah,
our,
yeah.
back our,
Yeah, I really don't know much about it, to tell you the truth.
Does the
I just
board
gave a
want me to
cursory
invite
glance.
him?
Simple disclaimer, Diane, if we were to say that the Board of Health does not endorse or,
Support.
support any of these, we're presenting this for information
Yeah.
purposes only, and does not reflect the opinions of any member or
well,
the
I would
board as a
ask,
whole.
I would ask that
Something
we
like that.
talk about it again
Sure.
and
yeah.
reconsider it before
Okay.
we invite somebody into the
Absolutely.
meeting, because I'm,
But over the years, there've been many people who have stood at that podium that I've been respectful and polite to, that I'm
Sure.
like, okay, you're a little odd, you know,
well,
have a good
but
night.
usually it's
Right.
if we're doing, I mean, we've done many regulations where we have people speak, we might not agree with them, but
Right.
we have a purpose,
Yeah. Right.
we have a purpose of why we're doing it,
Yeah.
and we have a conclusion. There wouldn't be a purpose right now to have a speaker come, and I'm just afraid that we would get people nervous, and
Okay, yeah, that's a fair.
so I just think if we could think about it, just
Yeah.
to see if it's appropriate for us,
Yeah, read it and
especially with
do some
everything,
research.
especially with everything else that's going on, you can't talk about,
Pipeline is, by
I
the
know.
way,
No
the
shortage of
pipeline
problems.
hearing, the Conservation Commission pipeline hearing is May 20th at 7:15.
May 20th, okay, 7:15,
Where?
fine.
I mean,
This building.
there,
so usually,
Oh, in this building, yeah, okay, probably in this room,
I was gonna say, usually they meet in this room.
okay.
May 20th, okay, good.
Okay,
Ed, thank you
any
very much.
questions,
Thank you.
anyone?
It's
No?
always a pleasure.
Okay, yeah, it's always a pleasure, I agree.
I always feel less smart when it's.
I actually feel smarter, I'm like,
So
oh, I
many-
got so much information.
something about
Excuse me?
fertilizer usage, we should get used.
Fertilizers?
Yeah, we should come back here and talk about it.
Natural fertilizers. always
Natural.
best. Yeah.
All organic.
Right.
Thanks for your time.
Thank you very much, Ed.
Don't forget my friends here. Don't forget my friends here.
See you later.
Take
Chair,
care.
if we need to
Bye, Ed.
move a little bit, because we're taking you somewhere.
Oh, okay. Members report decisions at every turn meeting.
I don't think I took many notes at that one. I thought, I figured.
Yeah, I was gonna say, it was a small group at this last one, but, I find them very informative, I really do.
Yeah.
I find them a good group, they're doing a lot of good. I know I spoke already about, they talk about, the numbers of the kids who have, got caught vaping, and there's also, they talked about, there's gonna be a device in the bathroom that, alerts them if there's any vaping going on. So they're working on the enforcement in the schools, which, I thought was good.
Right, and they spoke a little bit more about that, social norms, I think just a little bit about that. I don't think they had any results yet, or
Right, I think they're
or
gonna
they
do it
weren't
again
able
for
to
7th and
share
8th
them with
graders.
us, one of
Right,
those two.
yep.
They,
So it's not too much of an update, but it was
Yeah.
a good meeting.
yeah, it was a good meeting. They do a lot of good work. They really are an extension of us. They,
Good group.
yeah, they really do a nice job.
I think it's great that you guys are attending, actually,
So-
too, so. We're
Yeah.
learning a lot.
Well, again, hopefully at least maybe we'll lighten Mark's load at least one night a week.
Yeah, exactly.
Yeah, and the ones during the day, if you can't attend, I'll go.
Yeah.
Real quick, only because it's important, I think it's important maybe for this board. The EPA is holding a meeting in this room at 7 o'clock on Thursday night to talk about Nyanza, which is the next item on the agenda. Our chair of that committee, Dave Perry, unfortunately had a death in the family and will not be able to attend that meeting, but it's an important meeting. There might not be a quorum for that meeting for members, for whatever reason. Hopefully you'll be a new member in a matter of minutes, and don't forget to get sworn in.
Right, and I'm planning on going, but I
Right.
didn't know if I should reach out.
But what I wanted to stress to you is that meeting will take place because the EPA presentation will take place no matter what,
Right.
with or without the quorum.
And I know it's here
Right.
because it's televised.
It's here and it's
Yeah.
televised, and
Yeah.
it's probably an important meeting for people to go to. But I just wanted to make
Yep.
you aware, don't forget to get sworn in.
I won't, and I will be
Yep.
here for the
Okay.
meeting, as long as I'm.
All
Great.
right.
That being said, may I have the pleasure of appointing you for the Nyanza Committee as a member from the Board of Health?
I accept.
No, hold on.
No, I know, but I still have to accept it.
I'll second that.
Second
Thank
that. Further discussion? Seeing none, I can't think of anybody who would be better for it, so, all in favor?
Aye.
Aye. That's a 5-0. So it'll be here at 7 o'clock on
Yep.
Thursday. I probably will not be here at 7, but I plan to be in attendance by 7:30.
7:15
Yeah,
is my
so, I
final
mean-
offer.
What'd you say?
Said 7:15 is my final offer.
I mean, is the board planning on attending? Or we wouldn't be able to, as a board?
No, but you can attend, and you can attend as
I
a
mean, I will be
citizen.
attending
Right.
at,
And I'm
member
not a
of the
board
committee.
member anymore, so, after tonight, so. But it's
Not me.
too many years invested in it not to. Of all people not coming to a Nyanza meeting, oh boy, we could really get into that. We won't. Health agents report, budget.
Budget's in good order, and it did the 2020 budget has been approved for next year. And with small changes, one reduction. They kept the line item the same for contracted services, mostly because I think of the unknowns with the landfill, so they didn't change that part of it. And we should be able to get through the end of the year. We had a transfer for the nursing part due to the expenses, so hopefully we'll get there before the end of the year, and that's very soon, within the next 9 weeks. And then, update on the summer intern, her name's Kaylee Teagan, and we had our first discussion today, and she should be starting around the second to last week in May, in a couple weeks.
Where does she go to school?
She goes to school at the School of Public Health at VU for a master's
nice.
degree,
Very nice.
and she will be welcomed. Our discussion was very positive today. And then last but not least, the carnival at St. Cecilia's. The town's been meeting with the parish itself and the priest there, and we had a meeting last week, and looks like they're looking for June 20th through the 23rd, Thursday through Sunday. They'll probably block off Esty Street, and they're working on neighbors, making sure they're aware of it, so they're not shocked when they see all the carnival equipment move in. And they will need to get food permits with us. And that's it.
All right. Thank you very much for that.
You're welcome.
Review of minutes from our April 17th, 2019 meeting. Board want to take action on that this evening?
Everybody else set open?
It's just
Yeah, it was just the three of us, John, Diane, and
Copy?
No, I didn't.
I think
see
that's what she
in
gave me.
my- in
She
my
gave me
copy.
2.
There we go.
She probably wanted to punish me since I didn't attend the meeting, read the
Yeah.
minutes twice.
I was gonna say, is everybody else set with them? I can make a motion to approve the minutes of April 17th, 2019.
I'll second. Further discussion? Seeing none, all in favor? Aye.
I abstain.
Abstain.
2 abstentions, 302. All right, with that. And then you guys will have to discuss future agenda topics and meeting dates.
We talked about meeting the 28th, which is the week
That's
after
fine.
the
Go ahead
election.
and have it.
You're,
I'm off between 22nd May through 10th of June. I'm not here. You can have a meeting, no problem. And you can also reorganize if you want to. That's fine.
no, I mean,
Yeah.
always wait till there's a full board to reorganize.
We do have the 4th as our next scheduled meeting, right?
Yeah, well, we talked about I mean, I'm okay with not meeting the 28th.
Yeah.
I mean, if you wanna wait till the 4th, I'm fine with that.
Doesn't matter. We don't have any.
The
opinion.
21st is
Just have
election day,
pizza.
right?
Yep.
We have one pizza place
But
that's
it's
looking
not-
for grease management
But it
waiver.
didn't really apply to it.
Well, we could meet the 28th if we needed.
Yeah, if they come back.
I was
and-
thinking the 28th because, well, you were not, I was gonna say just
It's
kind of as an meet and greet, I mean, assumably Judy's
Right.
the election, but. All right, why don't we see, do they request a waiver yet?
No,
Okay.
they came in, but they haven't
So
been
why don't we leave
back.
it as the 4th, and if they request, we can meet the 28th?
If we have to, yeah, if we have to, we can pop it in.
Sounds good to me.
Did you guys, just to follow up on Ed's thing, did you guys wanna send any letters on his supporting legislation or not? Cause I don't think we closed that loop.
We don't know that she's not supporting it.
No.
It's
Okay,
prob-
I didn't know if you knew,
think-
I didn't
think-
know, I didn't
Oh,
know.
I haven't talked to her about it,
I
no.
think your point was the right one. I think it's probably just not
Right.
gotten to the Senate
Right.
yet.
Yeah, I don't think it's
I'd be
probably.
very surprised if she is.
Yeah, it's gotta get out of the house before she's gonna, okay, yeah, I just wanna
But
make.
again,
No, I
maybe
mean-
just kind of make a note for the
We
next
could,
meeting so we can,
we could craft a letter and say, please, when this gets to the Senate, we'd ask for your support,
Mm-hmm,
you know.
do that.
Can put it on the agenda.
there you go.
Okay, sounds good.
Can do that.
All right, anything else?
Before we go, I wanted to make a public announcement, if that's permitted.
It's permitted.
Okay. Yes, this is a showcasing day event that's happening on 19th of May. It's being planned by the town of Ashland as well as the Ashland Indian Club. It's meant for all of Ashlanders and outsiders to come and attend it. Please do attend it. It's being held at the Ashland High School cafeteria between 3 and 5 p.m. on 19th of May, Sunday.
So not this Sunday, the following Sunday.
Yes.
And tell people a little bit about it.
Oh, they're going to present different parts of India. There were 14 different states that participating, and they're going to showcase, and they're going to be free sample of food from different restaurants who have
Oh, really?
donated it, so they can understand more about India. And hopefully this will evolve into an international event in the subsequent years with different parts of the countries that's around here in Ashland.
You got my email about need?
Yes, I did. I've already told
Yeah,
that person
we
to go
gotta-
and then
Yeah, we haven't
talk.
heard back on the food coordination.
you will hear.
permits. Well, hopefully soon, because we gotta
They-
get a list of all the restaurants that are providing the food.
Yeah.
So, the sooner the better, and
Sure.
that way you can have a fun event and a safe
Definitely.
food situation.
Maybe
Sure.
we can put on the agenda for the next time, just to have a status update on the farmer's round market, just to see where they are.
Yeah, by then it'll be
Within-
close to 2 months.
Yeah.
Well, it's right, do I remember correctly, it's automatically after a certain amount of days? it's
60 days, I
automatic,
believe.
okay.
Yeah.
Just expires
So-
and goes back.
Motion to adjourn?
Second?
Favor?
Aye.
Thank you and good evening.
I pulled a Preston Crow on you.
Ah.